you mentioned this earlier, you came to my birthday party last week,
Yeah,
my
yeah.
virtual birthday party where I was turning 60. And really, what I decided that I wanted for my birthday was conversations like this with people that I admire and respect and who have had an influence on the way I think and what I do. You're high on that list. And there's a question that I'm still trying to formulate. I'm still trying to get the question, but it's something about getting older and
Oh,
something about what's that?
I've had a lot of practice getting older.
Okay, good. Because I'm getting practice. I can see it coming. I'm going to get more practice, like it or not.
Yeah.
What What do you know about taking care of ourselves as we get older? How well do you do? What's challenging for you? What helps? Those kind of questions.
Boy. Um, I have a lot of physical issues, a lot of injuries. Um, as far as people getting injured when they're working, I think it's trying to make things happen,
Yeah.
working too hard. Um, I think there's a not a fine line between accepting your limitations as you age, um, but oh, it's not Ezra Pound. I can't remember the British poet, but do not go softly into that dark night. Um, Tossing in the towel and saying, "Oh, I'm too old. I'm doing this. I've just got to." Lighten up. I think we all have to have something to look forward to with growth,
Mm,
and I continue to get better at body work,
mm,
and I'm always looking for something new. And
mm.
you and I discuss things, and light bulbs go on. I still remember some of the things you've done with me in the sessions we've traded, and it was an eye opener. And I
Likewise for
oh,
me.
knows so much, but no, and don't be afraid. It's not stealing or plagiarism to expand your skills, but get body work. But I think the main thing, just in life in general, is to not try to just get by, um, and yet not push yourself too hard. So I cannot. I went out about a year and a half ago. I'm not supposed to run. I've had two knee replacements, but long story. I do a little of that because I think I have pretty good shock absorption, and I ran a half marathon without training at all,
I
which
remember. I remember you
silly.
told me this.
That, but I used to go on 50 and 60-mile runs training for 100-mile runs. And, you just sort of do this. And I said, I just want to see if I can get through this half marathon. And I ended up running half the distance of a marathon in 3 minutes less time than the time it took me to run a full marathon. And I think I felt better about that than I did any marathons I ran.
And this is how long ago? This is a couple of years ago, wasn't it?
It's
When was
about a
this?
year.
A year and a half ago. So
Yeah.
why did I think I could ask you for wisdom about taking care of yourself? How did I get there?
It's a don't do as I say, not do as I do. But to say that fear, and let me just one other thing when you talk to people.
Yeah.
There's all this, I'm in Berkeley, and everybody's doing this and that, and the therapists are going to other therapists and trading, and all these questions are, feel your pain, feel your anger. I find that so many people are really uncomfortable being happy.
Hmm.
And um, I think it is important to see what people are afraid of. So people
Hmm.
come in with a problem, and you're looking at that shoulder, that back, that knee, but behind it all is I'm getting old. Is this what
Hmm.
old age is going to be about? What is this going to do to my athletic pursuits and things? And if you can clarify that with people about what does this mean to you, and you can just listen. You don't have to give them an answer on that, but they don't go that extra step of what the infirmity or what the complaint is. And since I coached running and athletics, because I had exercise physiology background, Kay, my friend, brought in a person who had foot surgery, and he wanted her teacher to sort of look at this. And I spent most of my time talking about why he was so sure that on March 15th, when the surgeon said 6 weeks had passed, that he wanted to get back to running. And I didn't play psychologist at any deep level. I say, your body doesn't give a whit about what your doctor or you or whatever.
Or the
And I
clock.
obsessive runner, you've got to listen to your body, and his just you see that light bulb go on in him. And it was like, because he was scared to death about going out on the 15th of March or whatever, and his foot problem coming up again. I said, you don't know, and if you have a little bit of a setback, it isn't that you're back at base one. It's a lesson to you. And, those are the gratifying things that we do.
Yes. Yes. Well, thank you. I know why I asked you about taking care of yourself. I know why.
Well, it's certainly, I don't look at myself as any paragon of wisdom, and I go fumbling along through life, and I can sit and talk about, all those problems, or I can look and say, well, here's a learning experience here. Let's see how I'm going to deal with that.